Schizophrenia is a relatively rare neurological disorder which affects more men than women. It is characterized by delusions, hallucinations, and other symptoms to watch out for are things like depression and apathy, which are characteristic of the disorder as well. The mechanism that causes schizophrenia is relatively unknown. Researchers think it might have to do with an overactive propagation of dopamine, which looks something like this. This is a dopamine receptor, and too much dopamine is being released. And researchers think this is what causes the delusions in schizophrenia. Schizophrenia does not exist by itself, but is rather on a spectrum of neurological disorders, which are likely all to be caused by dopamine production. And some of these disorders include things like bipolar disorder, which you may have heard of. Schizophrenia is classified into three parts: positive symptoms, negative symptoms, and disorganized symptoms. Positive symptoms aren't good things, but they're things that add to the disorder. Things like hallucinations and things like delusions. Well, negative symptoms are aspects of schizophrenia that subtract from the patient. Things like decreased social skills and depression and a lack of motivation and the need to isolate. Disorganized symptoms, on the other hand, are things like repetitive body movements that are seen in schizophrenics, as well as holding a unnatural posture for hours on end. Treatment for schizophrenia consists of several parts, and none of these are a replacement for the other. I'm going to recommend non-pharmacological therapy as well as drug therapy be taken. Non-pharmacological therapy or psychotherapy includes individual and group therapy to help educate both you and your family about schizophrenia. I cannot emphasize enough the importance of a family unit in helping patients with schizophrenia treatment. In addition to non-pharmacological therapy, I am going to put you on an antipsychotic that works by blocking the dopamine receptors that we talked about first. There's less dopamine being received. The drug is known as a second-generation antipsychotic, and some common side effects you may experience include weight gain, and this weight gain will also put you at a higher risk of developing diabetes, so that's something to watch out for. There is also a chance the antipsychotic will not work, and this happens in a fair percentage of patients, and in that case we would have a follow-up and put you on a different drug called clozapine, but the reason we don't put this as the first line of treatment is because there are more side effects. Additionally, there are people called case managers who will work with you to get you the services you need, so things like therapy and finding a home. And it's important to note that in the media there are few examples of what schizophrenia actually looks like. The people who are shown who are schizophrenics are crazy or bad people, but it's important to note that with the right medication, it's possible for schizophrenics to lead a relatively normal lifestyle. There was even a Nobel Prize winner who had schizophrenia. Schizophrenias are on a treatment that works and can stick to it. They can have a normal life expectancy and can expect to live a relatively happy life. I'm sure what you were experiencing has been very hard to live with, but I want you to know that there is support and treatment options that are available for you. Considering the onset of your symptoms, which was in the late 20s, which is a delayed onset for schizophrenia, this will likely mean you will have not a severe case of schizophrenia.